Pix 11 is bringing you a special report affecting millions of people in our area, diabetes and the high, sometimes dangerous price that folks are paying to treat it. So let's talk about some of the facts here. More than 100 million Americans are living with diabetes or prediabetes. In New York State, it's about 1.3 million with type 2 diabetes. So here to get the word out about this condition that we must not ignore is Dr. Ken Redcross. Good to see you again, my friend.
Good to be back. Thanks for having me.
So the big question here is, what are the telltale signs that someone is getting diabetes?
Well, Dan, this is the challenge. It's a little bit of a challenge, right? We know that there's frequent urination, feeling very thirsty, blurred vision, sometimes weight loss, but once again, non-specific a bit.
And these are things that everybody can kind of go through, and you don't think that it's diabetes. So the important thing is to come in and what, get a blood sugar test?
Yeah, you want to make sure you do that, and you want to make sure, especially if you have a family history, that's the big key here. You need to know what's going on in your family to know when you come in and get screened.
So what is the difference? Because, you know, everybody hears these words, type 1, type 2, gestational. What's the difference, and how are they treated, really?
All right, so let's think about it this way. Type 1 isn't as common, about 10% or so. That's when your body actually fights the cells that make insulin, all right? So that's more of an autoimmune disease.
Okay.
But it's type 2 that we're seeing so much here in the United States. Now, there is a genetic component to it as well, but also an environmental component. So the challenge is that you have more than enough insulin, but your body doesn't respond to the circulating insulin.
And gestational?
And gestational is a little different in that it's for pregnant women. Usually OBGYNs check it around 20 to 22 weeks. The challenge there is that you know that the woman could have increased blood pressure and the baby can be large, which also increases risk for problems and also subject to type 2 diabetes later in life too.
And insulin is such a big factor here, because as you get older, you see more people getting diabetes. And why is that?
You know, because you become a little more glucose intolerant, we call it. So it's even more important as we get older to make sure that you have a good doc and a good relationship to make sure that your blood sugar is being checked at least once a year.
You know, what I found so interesting were the numbers here. New York State has one of the highest rates in the country, specifically the Bronx. So why are we seeing it in more African-American, Latino communities?
Now, in the Bronx in particular, we have a large population of Hispanics in the Bronx, actually more than African-Americans. So there is a genetic predisposition. And so that's why we see such a concentration there in the Bronx. It's important, once again, to get the word out, to understand there are a lot of important things we need to talk about environmentally as well in our diets.
So I think people are saying, oh my gosh, I live in the Bronx, I have some of these signs he's talking about. Are there preventative measures before it really gets serious?
Well, you know, number one is going to be about education, right? Education, making sure you're getting into your doctor should you have any of these symptoms and signs. There also was a study that mentioned vitamin D. Now, vitamin D wasn't necessarily causal, but they found that those that were sufficiently there with their vitamin D levels actually had less of a risk than having diabetes. So get into your doctor, get your blood levels checked, or even consider there's nutrientpower.org. It's a website from a group called the Organic and Natural Health Association. You're able to order it and test your blood sugar or actually your diabetes or your vitamin D directly.
Okay, always good to have you here and talking about some of these hot button issues. By the way, happy birthday. It was your birthday yesterday, right?
Thank you. Thank you. It was my 21st. Thank you.
Thank you for coming in the day after.